So our speaker today, as you saw, is Lavern Banks Johnson. Her credentials are very impressive. She is an MSN, APRN, FNP.
Board certified.
Board certified. Thank you. So she was born in Arkansas, but raised in Memphis. And her first or early degree was in 1987. And then she went on to get all these other degrees, which is very impressive. She worked in all different areas of healthcare, including acute care, home health, hospice, case management, care coordination, and also an associate director of nursing. She has a passion, as you can see, by all her self-education in many different positions for caring for people. And she has her undergraduate degree from Union University right here in Germantown, and her master's degree from South University in 2011, and her postgraduate degree in family nurse practitioning in 2015. She's currently working with Memphis Health Center, where she works with HIV prevention. She's had tremendous impact in a very positive way in this role. And she's also worked as a CPR instructor through the American Heart Association for the past 10 years. So we couldn't let February, being Heart Month and Valentine's Day and everything about the heart, go by without having someone speak. And her topic, preventing heart attack and cardiac arrest and understanding the signs and symptoms. Welcome to as our Health Talk speaker this month, Lavern, and we look forward to hearing all these goodies that you have to share with us.
Heart attack versus sudden cardiac arrest, signs, symptoms, and preventions. Heart attack, one thing we want to know about heart attack is it is a circulatory problem, and it occurs when two blocked arteries are completely blocked because it cuts off the oxygen supply to the heart. So this is a picture of your heart and the main arteries of the heart. And so you can see the heart is covered by many vessels, and that's what supply the heart with with the blood supply, the oxygen, and the other nutrients that it needs. And so when you see that somebody say they had a quadruple bypass, it's usually involved one of the arteries that's listed. You have the right coronary artery, the RCA, the left coronary artery, the circumflex, the left anterior artery, and the coronary veins. Now, the blue is the veins, which has no oxygen in it, and of course, the red is the arteries that has the oxygen, and they supply different areas of the heart. Okay, here is an illustration of a blocked artery. As you can see where the arrow is pointing, that's where the blockage is, and the other part of the heart that it supplies begin to die. Now, one thing about heart attacks is that this occurs over a period of time. So this is not instant, and you might, experience some of the symptoms like tightness of the chest. And this is just another big view of what happens as plaque builds up in the arteries. So you can see how it builds up and then how it can completely block the artery and cause the damage to the arteries. Okay, some of the signs and symptoms of heart attack is many people complain of chest pain, which we call an angina, or pain in other areas like the arm, the shoulder, the back, the neck. Some people complain that they feeling, like heartburn or fullness or indigestion. Shortness of breath is a common sign of having a heart attack. Diaphoresis or cold sweat when you're sweating excessively, nausea, vomiting, dizziness, or you feel irregular heartbeats or palpitations. These are all signs of heart attack. Now, are heart attack symptoms different in women? Well, usually women have atypical signs, upper back and shoulder pain, jaw pain or pain spreading to the jaw, pressure or pain in the center of the chest, lightheadedness, dizziness, pain that spreads to the arm, or unusual fatigue for several days. Now, the important thing to know about this as it pertains to women is these are signs that we would probably write off. We wouldn't connect it with a heart attack. And they call these atypical symptoms because they are, symptoms that we might write off. And one important thing about heart attack, if you have these symptoms, it's best to get them checked out, because the sooner you get treatment, the less damage to your vessels if it is heart attack. Okay, some of the preventions: if you smoke, you should stop smoking, exercise regularly, eat healthy diet, a Mediterranean diet or DASH diet, lose weight if you're overweight, and manage cholesterol levels, hypertension, and diabetes. Okay, sudden cardiac arrest. Okay, it's an electrical problem, and that's the difference between heart attacks. And it occurs suddenly and often without warning, triggered by an electrical malfunction that causes an irregular heartbeat. Okay, this is a picture of the electrical system of the heart. You can see the SA node, the AB node. And I didn't want to go too far into this, but just shows the direction of the electrical system and the valves of the heart that it affects. And this picture is another picture of the electrical system, but you can see the EKG, the rhythm. That's like a perfect rhythm of the heart, and that's how it should look. But if anybody had chest pain or anything, we'll do an EKG, which would give us a picture of the rhythm, and it'll tell us where there is a irregular heartbeat going on. And these are the rhythms on the right side. The electrical rhythms, it shows you what valve it affects. And it stimulates your heart for the contractions of the atrial. And then that's what presses the blood out. And then the other electrical impulses in the other areas, it causes the ventricles to contract, forcing them to expel their volume of blood out into the general circulation. So it's very important. Okay, symptoms of sudden cardiac arrest is sudden collapse, no pulse, no breathing, and loss of consciousness. Okay, with sudden cardiac arrest, death can occur within minutes if immediate treatment is not given. And so you want to call 911 first, and you want to start CPR immediately. And if there's a AED machine or a defibrillator, you're going to need that to apply a shock to the patient to start his heart back in a good rhythm. Okay, some of the causes of sudden cardiac arrest: either coronary artery disease, a heart attack, enlarged heart, cardiomyopathy, valvular heart disease, congenital heart defect, and electrical problems in the heart. Okay, and in summary, I compared, for a heart attack, it's a circulatory issue. Sudden cardiac arrest is an electrical issue. Heart attack commonly occurs over minutes, weeks, or months. It gradually, like the artery gradually get clogged. But on cardiac arrest, it occurs suddenly. A heart attack, the damage worsens with delay in treatment. Like if you have these little symptoms, you don't go get them treated, then of course it will gradually worsen, and it could cause a sudden cardiac arrest. Okay, and sudden cardiac arrest, death may occur within minutes, so it is very important. That's why CPR is so important. So it's very important to initiate CPR and use the defibrillator. Oops. Let me go back. One. Okay, and that's it. Any questions?
Wow.
I have a question.
Mm-hmm.
You say there's a difference between cardiac arrest and heart attack. I had a friend of a friend yesterday die from shoveling snow.
Mm-hmm.
Are you saying that is from a sudden cardiac arrest, or that is a heart attack?
Okay. A heart attack doesn't always lead to sudden cardiac arrest, but if cardiac arrest occurs, it's usually because of a heart attack. Because the heart attack can cause dysrhythmia, so that's electrical. So it can cause the sudden cardiac arrest. It could be both, is what I'm trying to explain. He could have had a heart attack, which caused a dysrhythmia electrical wise, and which caused the sudden cardiac arrest.
And a follow-up question to that, or a statement, could you implore to the group how important it is to have CPR training, because most of us don't have defibrillators around to revive a person?
Yes, so the importance of knowing CPR is that the chest compressions, it kind of takes the place of the heart pumping the blood throughout the system. So with a sudden cardiac arrest, it is like imperative that CPR be started immediately to save this person's life, because they can die within minutes because there's no circulation. The heart has stopped. So the chest compressions would kind of like take the place of the heart, pumping the blood.
Lavern, how many times do you actually work on that chest? Is it continuous motion, or is there a resting period? Or
Well, the goal is to at least do 100 beats per minute. And when we teach CPR, we said to the song of Staying Alive. So you want to be pumping to that rhythm. So it's very quickly, but it's not it's good to take the CPR training, because if you don't do the compressions correctly, then you're not helping the victim.
Can you give an example of what you do with the Staying Alive?
Okay, so you got the pressure. When you're on the chest, in the center of the chest, you want to at least go down 2 to 2.5 inches for an adult. And so you're going to be with your elbows straight and just using like your shoulders and your back to press. And so you can just be pressing in a rhythm. You can count like 1, 2, 3, 4, or you can, the rhythm is, I don't do the Staying Alive thing, but that's one of the things we tell them to teach. I rather count. But if you know the song and the rhythm of the song, you're just going to press to the rhythm of the song. Or you can just count. It's not 1 and 2, it's 1, 2, 3, 4. So it's a really fast pace, but you want to make sure the depth is going deep enough, the 2 to 2.5 inches for the compression.
So with a song, you would press on what point of the song?
Well, I don't do the song, but you would just press, if you can sing the song, like, and to me, that's too much to remember if you don't know the words. I do the count. I teach my patients to do the count.
Press.
Right. Yeah, I do the counting. That's easier to me because it delays if you're trying to think of the words to stay in a line.
Okay.
Hey, TJ, since I'm on the prevention side of education, can you explain to everyone the importance, how diet really does affect the arteries, and that the heart attacks don't happen overnight?
Yes, the diet, the two diets I referred to as the Mediterranean diet and the DASH diet. And the Mediterranean diet is a plant-based diet. You want to just reduce the cholesterol and salt intake. You want to eat as natural as possible, because the saying, you are what you eat. If you eat a lot of fatty foods, it'll help, it causes all the cholesterol to build up and cause the arteries to clot. And it does happen over time, but it can, if you start eating correctly now, it is still helpful. You don't want to say, I've been eating like this all my life, so I'm gonna continue to eat like this. You can make changes now that would improve your arteries, clearing of your arteries and stuff. It's very important. And as far as the exercise, it helps strengthen the heart. So if you, when you exercise, your muscles are toned and tight, and the heart is a muscle that never stops working. So the exercise helps strengthen the heart.
Hey, Lavern,
Yes.
we had a question in the chat by David. He asked about being protected, their fear of doing it wrong. So can you kind of elaborate on that, about being trained and how we're protected?
Yes, you are protected by the Good Samaritan. And there's really no wrong. Even if you don't do the compression just right and you do 1 or 2 right during the whole process, that's going to help that patient than you doing nothing.
Yep. As long as we act within the scope of our training, correct?
Right, correct.
Yeah.
You
You're not a medical professional, so you can't provide a trachea or anything like that. But
correct. Right, you're covered is right if you're acting within the scope of your training.
Lavern, I was going to ask you, Lynn and I we talked to attorney Anthony Bradley, and he got a Google Watch that monitors blood pressure and heartbeats, things like that. What's your opinion of having a Google Watch that you could look at to kind of get you informed? And then my second question is, a few years back, I remember Katie Couric during a kind of like a seminar on the heart and the accumulation of plaque. They actually had this little machine that was at the end of it, kind of like a drill with a brush, that could remove the particles of the heart. And then they had a vacuum that would take those particles out of that system. But I've not heard anything recently on that. Could you address those 2 issues, please?
The first question you asked, oh, could you repeat the first question? I'm sorry.
Yeah, about the Google Watch, what's your
Oh,
personal
yeah, I
opinion
think,
of the Google Watch?
yeah, the Google Watch or anything that monitors your blood pressure, I think is good because blood pressure is called the silent killer. So a lot of people don't have symptoms. So I always tell my patients, when you have symptoms, that's a good thing because you know something's out of whack. But we don't have symptoms. If you have a Google Watch or something that monitors your blood pressure and your heart rate, it'll keep you in tune of what your body is doing. Because a lot of people walk around, you wouldn't believe with stroke level blood pressure. And as far as the cataract, I'm not familiar with that. I know we have like when plaque build up, they do like what they call a balloon. But as far as scraping something out and suction it out, I'm not familiar with that.
Lavern, where would we go to be for those of us who haven't maybe seen how to do CPR? It's been a while since I've looked at it. Just to refresh myself on it, where could I see a video or something, or what would you suggest that we could go
Well,
and look at?
if you go online, they have videos online to refresh yourself on how to do it. I am also a CPR instructor if you want a class. But you can go online and they'll show you and they'll go through the steps and you can print off, you know, you do 30 compressions to 2 breaths. It's got detailed instructions on there for you.
Perfect, thank you.
Yeah, TJ, can you put your information? I haven't looked through everything in the chat yet, but can you put your information in the chat? I will reach out to you for CPR.
Okay, I sure will.
I'm just going to get it off the internet and then read it while I'm working on them.
That'll be wasting time. Time is of the essence. And let me say this too, I mean, I'm a real pusher of CPR. And I know a lot of my students is like, well, I don't want to do mouth to mouth. Well, they have hands only CPR. It's just best to know how to do it, and because you can save a life. And sometimes the life you save is someone close to you because most cardiac arrest happens at home.
And Lavern, nobody carries this around with them, but I've actually seen like a mouthpiece that you can put on somebody where you actually wouldn't touch their lips. They actually have made that kind of thing. I thought was wild.
Yeah, you can have it on your keychain.
Well, Mark, if anything happens to you, I'm just going to work on your chest. That's it.
Yeah, leave my hair alone.
Lavern, one final question for me, and then I'll let the rest of the folks take over. I've got a couple friends that carry a aspirin in their wallet in case anything should happen to them. We've been heard they take a aspirin quickly. Your comment?
Well, in CPR, we recommend if the patient is not allergic to aspirin, if we think they're having a heart attack, we suggest that they give the aspirin and have them chew it. Because the aspirin, if you think about it, when the artery is getting so thin, the aspirin helps thin the blood even thinner, so maybe it can go through some of the vessels that haven't completely occluded.
And Lavern, I think it's important if we stress, fellow, just from a safety perspective, she said a key point. If they're not allergic to aspirin,
right? Always ask them.
Stranger that is having a heart attack, do not offer an aspirin to them.
Right, because you have to ask them if they're allergic. I always ask that question because some people are.
Yep.
TJ, I just want to say, you know, this is such an important, I mean, this information is so important, and how important it is not to ignore the signs. One of my husband's and I best friends, he was quite a bit younger than us a couple years ago. He was 50 years old, and he died of a heart attack in the waiting room to the hospital. He drove himself to the waiting room, but there were so many signs that he had prior to that, but yet he failed to go to the doctor. And it just breaks my heart to think that he could still be here today because you know, if he would have just gone to the doctor. And
right.
You know, I think so many of us, our pride gets in the way. Oh, I don't need a doctor, or I don't want to go to the doctor for whatever reason. To me, it's stupid. Bottom line, it's stupid. And I don't care if I offend anyone. You're stupid if you have signs and you don't go to the doctor. It's your own ignorance. and your own lack of love for yourself, and this is me on the preaching box, go to the doctor and help yourself. Love yourself enough to take care of yourself.
Right. And let me just say this, even if you go, because I went to the doctor myself because I thought I was having a heart attack and it was indigestion, but it's best to go and get it checked out, and don't let the medical anybody make you feel stupid for going, because you won't go. I mean, you just have to get it checked out. If you suspect, just let them tell you it's not. And for women, I had a patient, they dismissed her because she was still having her cycle, and they were saying women who still have their cycles don't have heart attacks. That is not true. She actually was having a heart. She ended up having to go to another hospital, and they would have had to do the EKG and the workup, and she was having a heart attack. But the other hospitals dismissed her.
Sometimes I think it's one of those situations where you say, I don't want it to be that, so I'm going to wait a little longer to find out. The thing about it is, if it's a car, it's okay. You waited too long, now you're going to have to replace. You can't replace yourself if you have symptoms that you have never really had before, even that really are causing, or a couple of them. You just say, hey, look, that's what insurance is for. And there's a lot of people, especially men, who waited because I don't want it to be that. I'm going to wait a little longer.
Right.
It's too late.
And sometimes when you do your physical, it's good to go to a cardiologist and just get a cardiac workup, just for have a baseline.
Oh, okay.
If anything changes later, they can compare the two.
That's good.
Someone
Lavern,
asked, David asked how to improve your circulation. You want to touch on that real quick?
Well, exercise is one of the key things to improve your circulation, and your diet. You want to eat as natural possible. Things with preservatives you want to try to avoid.
Did you want to keep sharing your screen, or do you want to?
Oh, I don't. Oh, no, I don't have to keep sharing my screen.
Okay, yeah, if you can take that down, that would be great, so we can see you better.
Okay.
While she's doing that, we're preparing to go into our breakout rooms. So if there is, I believe, Kurt, do you have the icebreaker question today for our breakout groups, Kurt?
I do not, but I can create something on the fly as a teacher. What do you consider success, and how do you help others in your business and other businesses succeed?
So what do you consider success? Okay, so that's our breakout question.
Can I elaborate on that a little bit?
You
Yes,
bet you can.
we were here, Kurt. We were like reading each other's minds because I had something if we didn't have something prepared. I got a quote by Dale Carnegie. And Dale Carnegie says, "The biggest lesson I've learned is the stupendous importance of what we think. If you knew what I think, you would know who I am. For our thoughts is what we are. But by changing our thoughts, we can change our lives." So that's all a part about success. So I just wanted to kind of elaborate on that.
All right, so we're going to go into our breakout rooms, and we do at Talk Shop what's called Bam Fam. And before we do that, let me go back real quick to Lynn McDonald so she can remind us who is our speaker next week.
Well, Joe, next week is Mastermind, and Joe has a wonderful story. We'll let her tell it next week to start us out with Mastermind, but invite your friends. It is a wonderful introduction to Talk Shop.
Great. All right, so let me spotlight myself here. Anybody else have anything you're burning to say? If it only takes a few seconds, go ahead and unmute yourself and interrupt me if you've got an announcement or something that you need to say. But while you're doing that, we're getting ready to go into our breakout rooms, and our coach, Tim Fleschner, and if you need some good coaching for your business, if you really want to jump the levels this year, get with Tim Fleschner and he can help you out. But Tim is going to be putting us into breakout rooms. We have an icebreaker question. What do you consider success? But then we do want you to concentrate on trying to help the people in your group. How can you refer someone to them? Who can you connect them with that will help them? What are some ideas that you may be able to share with them or they can share with you? That's what our breakout rooms are about, building each other's business. And we do that with Bam Fam, book a meeting from a meeting. So I challenge you today to book a meeting from this meeting.
Great
All
job, Laverne.
Great job.
Great
Good
information.
job. We appreciate our speakers. So we give you a hand. Y'all hang out, and Tim is going to be putting us.
Thank you.
And
Yeah.
we thank you. And if there's somebody you want to be in a group with, if you will text me or Tim, my number's in the chat log. We'll try to get you in there.
All
All
right.
right.
So
Tim,
what
take
I've-
it away.
Yep, what I've done, everybody, is we've actually got you on a rotation, trying to, where we won't be with the same people every week. And those of you that are guests, I've kind of just slotted you in. So take Kurt's conversation starter and talk about that. Joe, we go for 25 minutes. Is that correct?
That is, we go until 10, till close to 10:30.
Okay, all right. I'll put it for 20 minutes then. All right, guys. So I'm gonna separate you, and you should get something on your screen to join the rooms.
Got a timer on that, I'm sure.
Yes.
Okay, I hope to see all these people next week. We had a
Yep.
great group this week.
Thank you, everybody. Hope you come back.
All right. Joe, you're still recording if you didn't realize
Oh,
that.
let me